Hi, everybody. Welcome to Caring for Your Patients in a Socially Isolated World. Thank you for having me. Thank you for joining our session today. I am excited to be part of the Ontario MD Digital Health and Virtual Care Day. So before we get going, I do want to take a second to introduce myself. So I'm Alison. I've been a TELUS team member for a little over 6 years in a number of different roles. The number one constant in those roles has always been working directly with the product to find the best solutions for our clients. So I'm thrilled to be joining you today to showcase how some of our clients have adopted and utilized some of our tools to adapt and adopt a virtual care delivery model. So I thought it was important to set the context for why we felt this was an important presentation to make. So as we all know, the last several months has seen a very dramatic shift in the way we deliver medicine. So virtual care has turned into our new daily reality, and it may even be a long-term change in how we deliver medicine. So even though the way we're delivering medicine has changed, the priority has always remained focused on patient-centered care. The patient must always be at the center of care delivery, even when we're not in the same exam room, the same clinic, and we're not seeing them face-to-face for their medical care. So at TELUS, we always try to envision a way of how we can merge that reality of virtual care with your needs, the clinicians, as you maintain your personal connections that you've worked so hard to establish with your patients. So we can't lose the therapeutic momentum as you transition to the virtual care delivery model. So what we as TELUS quickly realized was that the more we mimic your existing workflow processes, the more successful you'll be in adapting to this new model. So that's what I'll be showcasing you today, is how we as TELUS have taken some of our tools, integrating them directly into your EMR in order to support your virtual care. So getting to our agenda, today I'll show you how to conduct an EMR virtual visit. I will show you how tools like Prescribe It can send e-prescriptions and manage e-renewals directly in your EMR, and how we can leverage integrated solutions to maintain effective communication with your patients. So the goal for me today is to highlight how patient-centered care can still be your focus using EMR integrated tools like the ones I'll be showing you today. So let's talk about our first tool that we're going to focus on today, which is EMR Virtual Visit. So EMR Virtual Visit is a product that TELUS felt was essential for effective virtual care delivery. So due to physical distancing and trying to minimize the in-person contact with patients, clinicians weren't able to physically see their patients in person. So they expressed, after trying to pilot this through telephone, that something was just missing without the visual connection to their patient, and that visual connection was paramount to successful care. So being able to see the patient's body language, seeing the skin conditions or rashes they're discussing, having that personal connection when conducting mental health visits. There were just so many types of visits that just didn't quite work when they only used the telephone. So this feedback from clinicians led us to EMR Virtual Visit, which is an integrated solution that allows you to conduct virtual calls. So you see your patients and also simultaneously take notes in their EMR record and see their medical history. So going back to TELUS initially recognizing that effective virtual care processes must mimic existing workflows, we know that the first key to success was that it must integrate directly into your existing EMR scheduling process. So we weren't happy with the different workflow for in-person visits versus a virtual visit. We wanted to enhance your existing workflow rather than have you modify them to accommodate the virtual visit solution. We also wanted to ensure that everybody, participants and clinicians, were able to access and participate in the EMR virtual visit. So we kept the technology requirements to a minimum. So all the patient needed to participate in a virtual visit is a mobile device they hopefully already have, or a computer with microphone and camera, and an internet connection. So we didn't want to institute apps to download or software to download. We didn't want to have a tricky registration process. All we wanted them to need to adopt this new solution was a device they, again, hopefully already had and an email address. So let's go into the EMR and show you how virtual visit works. So I'll show you how to book an appointment, what the patient receives and how the patient connects, and how to launch the virtual visit, and how you can actually interact with the interface once you're within the virtual visit encounter. So going back to TELUS enhancing workflows rather than modifying workflows. everything is still conducted directly through the EMR appointment schedule. So it's as simple as, again, picking my patient, confirming the email address on file for the patient, and the only change is changing this drop-down from an in-person to a virtual visit video. After I have that indicated in this drop-down, press OK. This is where PS Suite does the rest of the work for me. It's going to automatically send Armstrong an email to her inbox notifying her of the date and time and supplying her with a secure link to connect to the appointment. So looking at this earlier appointment, I'll show you what this patient received and the instructions we provide to the patient for how to connect to the EMR virtual visit solution. So I'm going to go into her email inbox, and here's where she has received the upcoming virtual visit notification. Here's where she gets confirmed the date and time. She gets basic instructions. She can click here for advanced instructions, including a YouTube tutorial. She can test her connection, which means she can test out her phone, test out her computer to ensure it's going to work. If she has trouble and needs assistance troubleshooting, she has a TELUS Health support line that's reserved strictly for virtual visit patients. So again, we wanted to take ownership of the IT troubleshooting and let you clinicians be clinicians rather than IT troubleshooters. When Teresa's ready, she's going to click Attend Your Virtual Visit, and she's launched again directly into that encounter. For the provider to start the visit, everything comes from the EMR schedule again. I can right click and start the virtual visit directly from the virtual visit window, where I can just press my Start Virtual Visit button to join the patient on the other side. So again, this is my interface to ensure my technology is working. You can see the appointment time, see the provider schedule. I can press Join. And there is Teresa the Pumpkin waiting for me on the other side of the virtual visit window. From here, I can, again, send her a chat. I can say, hello, can't hear you. She can reply back to me if she chooses. And in terms of how our workflow traditionally works, our providers do a split screen from their virtual visit window as well as their EMR record. So what that looks like is if I open her chart. So I can do a split screen and see her EMR record on the left-hand side and see her on the right-hand side of my screen. This allows me again to continue to make, to continue for me to make my clinical notes. I can continue to see her. Again, keep sending her chats through the chat functionality, and again, close my visit when I need to. So if I close the visit, again, that's where I'll get a pop-up saying it's been completed. I can go back, finish her charting on her record, or return to my main EMR screen to go on to my next virtual visit. So we launched EMR virtual visits fairly quickly at the start of the pandemic because we recognized it was important to get our clients a tool embedded and integrated into their EMR as quickly as possible. So we launched with what we called our base platform, knowing and predicting that we were going to need to make improvements based on the feedback from our users. So what we did is we actually put out a survey to over 1,000 clients nationally, and here's where I get to do one of my most fun and rewarding parts of my job, which is show you how your feedback had a direct impact on what we built into our product for functionality enhancements. So the first one I want to discuss is the virtual visit waiting room. This is where clinic staff and healthcare providers can check patient arrivals. They can do triage of appointments. They can confirm patient health information, put visits on hold. All of that is done through an easy-to-use interface of the virtual visit waiting room. The second major enhancement is the ability to send appointment invitations immediately. So moving forward, there isn't going to be a delay in sending the invitation to the patient. Once you make the appointment inside of your EMR, the patient's going to get that invitation immediately. So what this means is that you can actually turn a quick phone call into a virtual visit in case they mention a new skin rash or a new lesion they want you to look at. The third enhancement is saving the visit details to the record. So increasing that integration between the EMR and the EMR virtual visit. So once you press end on the virtual visit, we're going to provide you an option to save the start and end times of the virtual visit and also the chat log directly to the patient's EMR record. So all the documentation you shared, your length of the visit, the information provided through the chat, it's all going to be integrated directly back into the patient's record at your discretion. The last and final enhancement that is a fairly major enhancement, one of our biggest items of feedback, is the patient's ability to provide a photo to their provider, and also for the providers to share documentation to their patients. So the patients can upload a picture from their mobile device or computer directly to the chat. The provider can view it full screen and even has the option to save the photo directly to the patient record with one click. The opposite is also true. We want to provide the provider the functionality to share files directly with their patients. Maybe you want to share a lab rec, a clinic brochure, an education sheet. All of that can be provided to the patient directly through EMR virtual visit chat functionality. While it isn't quite the same as an in-person clinical visit, hopefully you've seen how EMR virtual visit provides an alternative to in-clinic patient visits. It still allows you to see the patient's body language. It still addresses that personal connection that you've worked hard to establish. And you can even share photos and documentations with your patients directly through the application. So it's also an example of how we can remain the priority on patient-centered care. As a patient, I don't need to drive an hour to get to my appointment. I don't need to battle traffic and parking. I don't need to wait in a busy waiting room, not physically distancing from other patients. It provides me as a patient a convenient, time-saving, cost-saving alternative to therapy that still allows me to maintain my personal connection that I value with my clinician. So now that you've seen how EMR virtual visit is integrated directly into your EMR, let's focus on the next essential communication tool in the virtual care model, which is prescriber to pharmacist communication. So the partnership between prescriber and pharmacist is even more crucial in the virtual care world. Patients aren't coming into the office for prescription renewals. Physicians are working from remote locations, so pharmacists can't just pop into their office for clarification on prescribed treatments. Prescribers and pharmacists really had to adjust to the virtual care reality, as it had a huge impact on medication safety for their patients. So this is where Prescribit can have a huge impact. So Prescribit is a Canada-wide electronic prescription service that connects prescribers to pharmacists. So it's a national solution. It's designed to increase that collaboration within the circle of care. It really is seamless integration between your EMR as a prescriber and also the pharmacist PMS system, which creates stronger, more accurate communications between prescriber and pharmacist. So it is a bidirectional communication. It allows you to send prescriptions directly from your EMR to the patient's pharmacy of choice. It also allows the pharmacist to request medication renewals directly from their system and are returned directly to your EMR. When I talk about Prescribit with some clinicians, they're sometimes under the impression that e-prescribing is just another way to transmit and send medications and therapies to a pharmacist. Prescribit truly is so much more than that, and it's much more than just a paper prescription. With Prescribit, when I send a treatment to a pharmacist, not only am I sending the treatment name, the dosage, the duration, I'm also sending along data like my prescriber information, the patient demographics, the patient allergies on file, maybe the recent vitals and medication interactions I've managed within my EMR. All of that information vital to the pharmacist gets sent along with your treatment prescription. All of this is done through no changes to your EMR workflow and requires no additional action by the prescriber. So another way Prescribit can enhance the collaboration and partnership between prescriber and pharmacist is through the automated dispense notifications. So dispense notifications are sent from the pharmacist system back into the prescriber's EMR to indicate what activities, if any, have occurred with the submitted prescription. So these notifications contain crucial information for medication adherence because the prescriber can see if they're even filling their medication, maybe the frequency of their renewals, what medication was actually dispensed by the pharmacist. Maybe the pharmacist substitutes a generic for a brand name. Maybe they want to have their narcotic prescriptions refilled too quickly. Maybe they never actually pick up their prescription at all for hypertension that you prescribed. All of that information is now available to the prescriber through the Prescribit dispense notification system. So let me show you the prescriber workflow to send a prescription request in PS Suite to a pharmacist using Prescribit So let me just pop into my EMR for a second. So take a look at the workflow to submit a prescription through the Prescribe It interface from PS Suite. So I'm going to open up a brand new record. I'm going to actually prescribe Donnie Richfield a new medication for his Raynaud. I'm going to open up the prescribing window in PS Suite and complete my prescription as usual. And I'm going to have the option of which pharmacy I want to send it to, whether it's going to be a Prescribe It pharmacy versus a fax-based pharmacy. I can see the indication right on the left-hand side of which one actually subscribes to the Prescribe It service. He has my preferred pharmacy number 1 already selected for me. And I'm going to press this e-sign and send button to submit this Plendo through the Prescribe It interface directly to the Kroll pharmacy. Once I send the prescription, we update the medication history appropriately. And not only do we just send across the dosage, the treatment, the duration, the frequency, that's all going to be submitted, but it's also going to submit his allergy to his ACE inhibitors. It's also going to submit any interactions I've modified. It's also going to submit his demographics to that pharmacy to ensure that pharmacist gets a complete view of his medication history and his current allergies and its demographics. So the rest of the data kind of rides along with the prescription just to increase the efficiency of communication between the prescriber and the pharmacist to make that partnership even stronger to ensure the patient, again, gets the best medication outcomes. So again, the partnership between prescriber and pharmacist goes beyond sending prescriptions and e-renewals back and forth. So Clinical Communications is a messaging platform within Prescribe It that's directly integrated into your EMR and pharmacist system, which allows the prescriber and pharmacist to exchange messages back and forth about the patient outside of submitting a prescription and requesting prescription renewal. So sometimes new symptoms are reported to the pharmacist by the patient. Sometimes the pharmacist might not have the proper inventory to fill a prescription as written. Sometimes they need to clarify the compound and ingredients for a topical cream. These are the type of conversations that go well beyond sending prescriptions and renewals back and forth, but these are the daily communication requirements between prescriber and pharmacist. So clinical communication is a tool that further facilitates that enhanced communication and partnership between the prescriber and pharmacist to ensure the patients receive the best care for their medication treatments and history. So getting back to the concept of it being bi-directional communication, e-renewals are prescription renewal requests that appear directly in the patient's EMR record. From that e-renewal request, a prescriber can approve, deny, or modify that request. So the pharmacist can request renewals sent through Prescribe It that appear directly on your patient's record that have increased information about what they're requesting from you in terms of dosage, maybe new symptoms, allergies that the patient has reported. That all gets returned to you within the e-renewal request. We've actually recently revamped the e-renewal request process at Prescribe It to make this communication even more powerful, provide more clear, more concise information, and find further efficiencies for the prescriber in this workflow, because it is such a vital piece of communication between this prescriber-pharmacist partnership. So I'm going to show you how the e-renewal request comes directly into your patient's record and how you can act on that e-renewal request right from that message sent from the pharmacist and return your approval, denial, or modifications back to the patient's pharmacy. So here's an example of a prescription e-renewal request coming directly from a Prescribe It pharmacy. It appears directly on the patient's record, and I'm given the option to actually process this e-renewal directly from the record. So here is my information provided by the pharmacist, including their comment. So patients going away on vacation might indicate why he's asking for a prescription renewal a little bit early. And I can select the match from the patient record. So I've already see he's on bisoprolol from his chart. I can click on that to approve that and continue. Or I can deny the specific request and list a reason for the pharmacist of why I may be denying this request at this particular time. I'm going to actually approve this request. I'm going to press my continue button, and I'm still able to make changes to my prescription after I proceeded through the interaction warnings. So again, here's where I can make my modifications if required, and I can just press my e-sign and send this bisoprolol back to the pharmacist who requested it. So here I am going to press e-sign and send again to submit this back to the requesting pharmacy. It's going to, again, submit the e-prescription through Prescribe It. It's going to make an addendum to my message saying I have already approved this e-renewal request. I'm going to update my medication history based on my new prescription. So everything kind of happens all in one window. I can approve, modify, deny the request from the pharmacist, and I can actually send a prescription directly back through Prescribe It from the message I received directly onto the patient's record. So now that you've seen how prescription requests and e-renewal requests are facilitated within the EMR, let's just take a step back and think about it from the patient's perspective. So if I, as a patient, just conducted a virtual encounter with my physician, maybe they want to start a new medication, I don't want to have to go into the office to pick up a paper prescription just to take to my pharmacy. So what Prescribe It enables is the ability for the prescriber to automatically submit the prescription to my pharmacy of choice, as well as any additional details and information the pharmacist might require, such as my allergies or my interactions. My experience going to pick up the prescription is that I don't need to re-enter my demographic information. I don't need to keep repeating my medication history to my extended circle of care. My pharmacist is aware of my allergies. They know I've already discussed a contraindication with my prescriber. All that information transmitted through Prescribe It makes that patient experience of managing their medications that much stronger and that much better. So moving on to our last item on the agenda, which is focusing on patient-provider communication. When you're seeing patients virtually, it can sometimes be challenging to maintain effective, timely communication with your patient when they aren't in the same room as you. So we have a number of EMR tools that are integrated directly into your solution that enhances the communication between patient-provider to ensure that both sides get the information they require in a timely fashion and in an effective fashion. So TELUS has a number of EMR value-added services that are, again, directly integrated into your current workflows. These value-added services allow you to do things like book appointments online, deliver appointment reminders to your patients, request a patient-complete e-forms, and you can even broadcast clinic updates directly to all of your patients. For example, maybe you want to announce the start of your flu clinic and the times that you open for flu clinic. Maybe you want to coordinate care for all your patients due for preventive care requirements. All of these value-added services can be utilized to make that communication efficient and delivered to your patients in a secure manner. So I'm going to show you how our EMR integrated services can be utilized to message your patient about upcoming preventive care requirement, so some will be due for a PAP, and request that they actually complete a standard mental health screening form. So you'll see that it's integrated directly into your EMR with a single sign-on and can even pull key information from your record into this value-added services tool. So I'm going to open up a patient record here. And using one of our EMR integrated tools, I'm going to send Miss Piggy a message directly to her email on file and also include a screening form for her to complete. So after I've sent out that message, it's going to go directly into her email. She'll get the request directly back to her email asking her to view the secure message and complete the questionnaire. She'll get asked to confirm her birth date, and she gets a notification of the pap smear reminder, and she'll have to get launched right into the PHQ-9 questionnaire. When Miss Piggy presses the finish button, it's going to automatically collect her answers and submit that back into the EMR automatically. So just so you see what's documented in her EMR, we automatically append the message you've sent out. We automatically append the patient confirming receiving the message. We automatically upload her PHQ-9 values in a way that's measurable, so we can actually trend her PHQ-9 scores over time. So this is one example of how our EMR add-on tools really enhances that patient-provider communication, because it provides an integrated EMR tool that allows you to collect measurement-based outcomes, send notifications to your patients directly through the application, and have that automatically fed back into your EMR records so you have it for future reference. So I want to say thank you for attending Caring for Your Patients in a Socially Isolated World. Hopefully you have a good understanding of how our EMR integrated tools can maintain the focus on patient-centered care in this new virtual care reality. So TELUS and myself welcome your feedback and any questions related to this presentation. You can direct those questions to the email address shown on screen, telussales.emrs@telus.com. I do hope you enjoy the remainder of the Ontario MD Digital Health and Virtual Care Day, and I do hope the next time we meet at a conference, it will be in person rather than over webcam. So thanks again for attending and looking forward to seeing you all again.